so far. This is not a new disease. Experts say that China is dealing with an outbreak of Hmpv. That's the human metapneumovirus, Hmpv. This virus has been around for at least 60 years. It is quite common and easy to catch. So unlike the Wuhan virus, this time they seem to be dealing with a known disease, and yet there are reasons to be worried. The first reason is the scale of the outbreak. It is massive. Cases have been reported in multiple cities across China: Beijing, Tianjin, Hebei, Shaanxi, and Inner Mongolia. These 5 areas have reported the highest number of cases. But we don't know about the actual caseload. As usual, China has not shared any data, so we don't know how much worse it could become. The second reason to be worried is the nature of the patients. Hmpv attacks the younger sections of the population, the children and adolescents. They are the most vulnerable to contracting this virus, and a large number of patients right now are also children. Plus, treatment is also challenging because just like the Wuhan virus, the Hmpv is a respiratory disease. There is no drug to treat it. There are no vaccines either, and the symptoms are similar: fever, cough, and shortness of breath. That's what Hmpv patients have. In severe cases, they can develop other complications like bronchitis or pneumonia. So they may need intensive care, oxygen, or even a ventilator. Again, does it sound familiar to you? We all know what happens when hospitals are overwhelmed, when there are too many patients to treat and not enough resources, when oxygen supplies are about to run out, when patients cannot find beds for treatment. Hmpv is not the same as the Wuhan virus, but it can easily wreak havoc on the health system. China knows this too. In fact, its hospitals are already feeling the strain. Despite that, it refuses to come clean about the outbreak or its scale. It seems to have learned nothing from the last pandemic. It remains in a state of denial.
Shalom, giving all praises, honor and glory to Yahweh, Bahashem Yahweh Shai, Waha, Recha, Kodash. Honors to the elders and apostles of Great Millstone, and other like-minded elders in Israel that teach well, by whom I learn this truth, through the spirit and power of Yahweh, Bahashem Yahweh Shai. Shalom, Barakim, to the hopeful elect house of David. Citation to you, Akim, that are laboring, ministering week in, week out. Give up your bodies as a living sacrifice unto Yahweh, Bahashem Yahweh Shai, in all truth and sincerity. Right, this is the brother Daniela, and this is just a quick news update, a recap of what's going on over there in China at the moment, right, concerning these new virus outbreaks, right? So this is just a quick hit through the spirit and just a quick news update, man. So this is in the Mirror newspaper over here in the UK, right? And this article, and it reads, all you need to know on Hmpv as China hits new virus outbreak, right? And if you remember, around the time of the COVID, right, the C19, right, pandemic, as they call it, right? China was one of the first places to go into major lockdown, right? Because they were actually saying that the virus came out of Wuhan, right, which is in China, right? So it says multiple viruses, including influenza A, Hmpv, mycoplasma pneumonia, or pneumonia, Salakia, and COVID-19 are reportedly circulating in China, right? So not only this the COVID circulating, but also influenza, this new one, Hmpv, mycoplasma pneumonia, right, reportedly circulating in China. It says China has become the epicenter of a new virus, right, just like it was what's that, 4 or 5 years back, right? It's well, there you go, just 5 years after the outbreak of the C19. It says the human pneumovirus, pneumovirus, Hmpv, right, is tearing through the country, causing chaos in hospitals and leaving crematoriums overflowing with corpses, right? So this new virus that's popping off over there in the land of Moab, is taking out these heathens, man, right? And it's in leaving hospitals and crematoriums overflowing with corpses, according to reports on social media, right? It says multiple viruses, including influenza A, Hmpv, mycoplasma pneumonia, and COVID-19 are currently circulating in China, with rumors emerging that Beijing has declared a state of emergency, though there has been no official confirmation, right? It says the virus, which is more common in winter and spring, can cause symptoms similar to flu, affecting the upper respiratory system. However, in some cases, it can also lead to lower respiratory infections. HMPV causes flu-like symptoms and usually affects the upper respiratory system, but can sometimes cause lower respiratory infections, right? And a lot of the symptoms that these people are getting over there from these viruses are similar to the symptoms that people are getting over here in Europe and over there in the Americas, right, in Babylon, concerning this mysterious fog, right? This mysterious fog that everyone's been complaining about, that everyone's been witnessing, right? And it just so happens as well that when you go and study the symptoms of radiation poisoning, right, they bear a lot of similarities, man. If that's the word, similarities. So like, yeah, similarities, right? There's a lot of similarities with those symptoms, man, when it comes to radiation poisoning and the symptoms of these viruses, right? And it says among the symptoms are what? A cough, fever, and nasal congestion, sore throat, and shortness of breath. And a lot of people, not just only in China, but over, like I said, over here in the UK, in Europe, and over there in America, a lot of people been going through these same symptoms. Even some people I know, right? It says sore throat and shortness of breath. It is spread between people through coughing, sneezing, or person-to-person contact. And again, this is sounding similar, very, very similar to what they were saying in the time of the COVID, right? When that was widespread, right? It says coughing, sneezing, or person-to-person contact. It's thought that the virus incubates from 3 to 6 days and can last different lengths of time depending on how severe the infection is, right? One of the main dangers is that HMPV can cause more severe illnesses that can be a threat to life, like pneumonia, bronchitis, bronchiolitis, asthma, and COPD, right? And this is why they're saying the hospitals and the crematoriums and the funeral homes are packed up, man. Meaning you got people dropping like flies, man. Right? It says young children, older adults, immunocompromised individuals can develop more severe illnesses if infected with the virus, according to NDTV. Right? It says to prevent contacting HMPV, people can follow a number of steps listed below. Right? HMPV prevention tips says using soap and water, wash your hands for at least 20 seconds. When coughing or sneezing, make sure to cover your nose or mouth. And like I say, these things are sounding very, very similar to the precautions that people were being told to take concerning the C19, man. Right? It says when coughing or sneezing, make sure to cover your nose or mouth. And this is not the only so-called virus, right, or pestilence or plague that's going out right now. You got cases of the bird flu over there in America, in Babylon, in different states, right? They're talking about bird flu poisoning some of the water systems, right, in certain states over there in America, to where now in certain states they're mandating the face mask again, right? And this is something that, this is something that we've been telling the people. As soon as they post pandemic, concerning the CV, this is something that we were telling the people, man, that they're gonna implement another lockdown, right? And the masks will be back, right? And lo and behold, man, it says, and I'm just trying to be very careful of what I say, because they do tend to flag the brothers' lessons and these kind of videos, and say medical misinformation. But I'm not doing anything than reading the articles in these newspapers, right? Which are very well known newspapers, right? So again, it says when coughing or sneezing, make sure to cover your nose or mouth. You could also wear a mask and avoid coming into contact with people who are sick, right? Again, this is why I say it's reminiscent. It sounds reminiscent to what we were being told over the C19 pandemic, man. Right? I know brothers and sisters remember, man, the 6 meters, right, or the 6 feet that people had to stand behind each other when queuing in shops and whatnot, right? The facial mask mandate. Everyone had to wear these face masks, and depending on what country you were in or what city or town you were in, man, some of the rules were even more stringent, to where I saw videos of, people being beaten in countries like China, Russia, if they didn't have their face masks on, right? It says don't touch your face unless your hands are washed. Self-isolate if you are ill. Again, man, very reminiscent to what they were telling us during the COVID times, man. Right, it says in September, a doctor issued a stark warning about the lesser known virus which lacks a vaccine. So apparently they haven't yet concocted a vaccine for this particular virus. Right, well, it's the same again, reminiscent to what they were saying before they were pumping out the C19 vaccine. Pfizer, what was the other ones? Pfizer, you had the AstraZeneca, and I forget the name of the other one. Right. So speaking with the Daily Star, Dr. Samir Sada from Carl Heath in the US highlighted the dangers of the HMPV, noting that it could be fatal for around 1 in 10 young children who contract the virus. Unlike flu and COVID-19, there are no vaccines or specific treatments available. So, this is just something, this is another fear tactic that they use, right? And this picture here is in Shanghai, man. Right, health workers wait for people to scan their health code to test for the C19 coronavirus. Right, in Jing'an district in Shanghai, and this was in 2022. Right, suited and booted, boy, masked up to the T. Right, so this is what's on the cards, man. This is what's coming, and we've been telling the people that there was gonna be another lockdown, man, and it's looking like it's all starting in China again. Right, go figure. Right. So the human meta pneumo virus, man, the HMPV, right? And they're saying there's no vaccine for the virus, right? So people are being urged to wear the masks and avoid crowds, right? Flu-like symptoms, man. Flu-like symptoms, and like I said, it just so happens that the symptoms are, all you gotta do is check out your symptoms for radiation poisoning, and you'll come to find out it's a lot of the same symptoms, right? Let me see if I can just pull up this article. Where are we? Let's pull up this one. This is in the New York Times, right? It says, eyeing potential bird flu outbreak, Biden administration ramps up the preparedness, right? They said the administration is committing an additional 306 million towards battling the virus, which will distribute the money before President-elect Donald Trump takes office, right? And he's just about to take office, man, in the next few days. Right, it says the Biden administration, in a final push to shore up the nation's pandemic preparedness before President-elect Donald J. Trump takes office, announced on Thursday that it will be nearly double the amount of money was committing to a ward of potential outbreak of bird flu in humans. Right. Now, my question is, what are they gonna do with this 306 million? Right. What kind of precautions are they gonna take? Right, it says federal health officials have been keeping a close eye on a H5N1, a strain of avian influenza that is highly contagious and lethal to chickens and have spread to cattle. Right, and they're also saying now that it's also spread to some of the water systems, man, over there in certain states. It says the virus has not yet demonstrated that it can spread efficiently among people. Right. So yeah, this particular bird flu is among the birds and the chickens and the cattle at the moment, right? But that's not to say that it can't spread to humans, right? This is on Thursday. An administration said it was committing 306 million towards improving hospital preparedness, right? So they're preparing, man. They're preparing, right? Early stage researchers on the therapeutics, diagnostics, and vaccines. About 103 million of that will help maintain state and local efforts to track and test people while exposed to affected animals, and for outreach to livestock workers and others at high risks. So this is even with this is just another excuse to call off the livestock, chickens, cattle, and whatnot. Because we also know they're trying to, with all this that's going on, they also try to bring about famine, man. Right? Like I say, by buying off all the farming land in a lot of states over there in America, even over here in the UK, right, and across Europe, right, they've been buying up a lot of the farmland and paying off farmers, man, right? So they've been culling a lot of cattle and livestock, man, over the last 3-4 years, right? You've been hearing a lot of chicken factories going up in flames, right? This is not a coincidence, man. Right, this is not a coincidence. This is by way of means to bring about and orchestrate a worldwide famine, which is also on the agenda, man. So yeah, and ultimately all these things we see going on, it's all prophecy, man. Because like it reads in what's that, Matthew 24th chapter, right? We're entering into those times like that have never been, man. Nor will ever be after it, man. There's a lot going on, you know. And this is just by way of means, like I said, to bring about that NWO that the elites are trying to bring about, you know. So expect another lockdown, and over the next few coming days and weeks, expect to hear more and more on these plagues, pestilences, and new viruses that are popping up, man. You know. Let me pull one precept. This is Ecclesiasticus or Sirach, chapter 40, verse 9. It says, "Death and bloodshed, strife and sword, calamities, famine, tribulation, and the scourge, these things are created for the wicked, and for their sakes the flood came." Right? That's right, man. It also says in 2 Ezra 15th chapter, I believe, that many great miseries, man, shall be done to them that dwell in the world in the latter days, because they've walked in great pride, man. Right, so we're going to continue to see these judgments, right? These this tribulation, these calamities, this strife, bloodshed, destruction, man. That's what's on the cards, 2025, and the year started off with a bang, as brother's been saying, you know. And like the elder apostle Tahar said, Lord willing, this is the hopeful year of our deliverance, man. Destruction and judgment, right? And it started off exactly, in that way, man, and may it continue. Adawan Ratazar, man. You know, so yeah, just a quick news update concerning what's going on over there in China. Lord willing, I could update brothers and sisters over the next couple of days. You know, but with that, I want to give all praises, honor, and glory to Yahweh, Bahashem Yahweh Shai, Waharaka Kodash, Brakatha Yahweh, Brakatha Yahweh Shai, and Shalom to the elect.